What is late onset hearing loss? Late onset hearing loss is when a child is born with full hearing. Generally speaking, they pass the newborn hearing screen in the hospital, but something happens along the way and they lose their hearing after birth. At some point, their hearing deteriorates or changes permanently, and that is late onset hearing loss. Late onset hearing loss can include mild all the way to profound loss, and can also include single-sided or unilateral hearing loss. There are many causes or risk factors that can contribute to it. Genetic factors, NICU stays of greater than 5 days, viruses such as CCMV and meningitis, chronic ear infections, head trauma. There are, and sometimes there just is no known reason for late onset hearing loss. And in those cases, that can be particularly hard for families. When my daughter Bridget was 2 years old, we discovered that she had lost her hearing sometime after birth. We didn't notice, and it was developmental delays, language and speech delays that was the red flag for our family. And at first, we had no idea what the cause was. She was diagnosed with a bilateral sensory neural hearing loss, moderate sloping to severe. And we had a lot of questions. We did not have a lot of answers, and we needed to make some decisions pretty quickly about what we were going to do. We did eventually learn that she had inherited connexin 26, which is a gene that can cause hearing loss in infants and young children. So what can parents do to support their child with hearing loss? There are several things. There's actually a lot of things that families and parents can do. The first one that comes to mind is to focus on language and communication. So whether that is an oral language route or a listening and spoken language route, whether it is ASL, whether it is incorporating cued speech, whether it's a combination of some of these things, focusing on communication and language acquisition is absolutely something that families can do, and early intervention providers can help assist the family, staying closely connected with providers during the course of the journey, keeping appointments, seeking unbiased information whenever possible, including family-to-family support. The Center for Family Involvement at VCU has 136 family educators that parents can connect to. And lastly, really focusing on your own emotional health as a parent. This is a long journey, and in some cases it's a hard journey, so focusing on that is absolutely beneficial for everyone. Children with late onset hearing loss, just like my daughter Bridget, who is now 15 years old, can lead totally normal, successful lives. Parents learn how to advocate for their children, for what's best for their children. They lean on other parents for support. They remember that their child is a child first. And these are the children that thrive.